bones, muscles, and joints that work together to have a movement like walk, run, and jump.
There are 5 components of musculoskeletal system. First is bones are hard structure that give the body its shape and support our internal organ. Also store minerals like calcium and produce blood cells. Second is a muscles are soft tissues that contract and relax to generate force that allow body to have a movement. And the third is joints are the connection between two or more bones that flexibility and allow for a smooth movement. Fourth is a tendons are taut fibrous tissue that attach the muscle to the bone. And the lastly is a ligaments are strong connective tissues that connect bone to bone to help stabilize joints and preventive excessive for the movement. This component also have 3 main functions. First is a support by forming the body framework and maintain its shape. 2 is a movement by working as a levers and force to perform daily activities. And the most important is a protection that a vital organ such as a skull to protect the brain and a ribcage to protecting the heart and the lungs.
Thank you to my friend for the previous explanation. Hello everyone, today I will explain the exoskeleton, the appendicular skeleton and the functions of each part. The human skeleton has 206 bones and is divided into 2 main parts, the exoskeleton and the appendicular skeleton. First is the exoskeleton. The exoskeletons form the central axis of the body and consists of 80 bones. It includes the skull, the vertebral column or spine, the ribs and the sternum, also known as the breastbone. The functions of the axial skeleton are to support the head, neck, and trunk, to protect vital organs such as the brain, spinal cord, heart, lungs, and to maintain posture and body stability. Next is the appendicular skeleton. The appendicular skeleton consists of 126 bones. It includes the shoulder girdle, the upper limbs or arms, the pelvic girdle, and the lower limbs or legs. The main function of the appendicular skeleton are to allow body movement, to support walking, running, lifting, and other daily activities, and to provide attachment points for muscles, which help produce movement. In summary, the exoskeleton mainly provides support and protection for the body's vital organs. Meanwhile, the appendicular skeleton is mainly responsible for movement and mobility by working together with muscles. Both parts are equally important because they help our body stay protected, balanced, and able to move efficiently. Thank you. Now that we have learned about the 2 main divisions of the skeletal system and their functions, I would like to invite Sarah to continue with the next part of our presentation. Thank you.
For my part, I will be explaining the muscular system, which discuss the structure, types, and the function of each of the muscles. For the structure, we have muscle, fibers, fascia, and tendons. This muscular and skeletal system work together to provide form to support for stability of the body and for the movement. For muscle fiber, it is to move bones and body parts to maintain posture upright and balance, also to generate heat where it helps to maintain body temperature. Furthermore, fascia is a connective tissue that envelope, separate or bind together all the muscles. Moreover, is tendons. It connects muscle to the bones and transfer the force that are produced by muscle to move the bones. Tendons also store and release energy during walking, running, and jumping. Here, I insert a picture of the structure of our muscular system in our body from the front and back view. Next, I will show you the 3 types of muscle tissue. First, we have skeletal muscle. It attaches to the bones and makes body motion possible voluntarily, and it has striated appearance. Next is smooth muscle, or known as visceral muscle. It is located in the walls of the internal organs such as digestive tract, blood vessel, and ducts, which lead to the glands. It is for moving and controlling flow of fluids. Lastly, myocardial innervation. It is forming a muscular blocks of the heart, where it provides constant contraction and relaxation, which causes the heartbeat to improve.
Hello everyone, today I will explain how our amazing muscular system works. This system is what holds our body upright and makes every movement possible, from walking to waving hello. First, let's look at how muscles move our bones. We have special muscles called skeletal muscles that are attached directly to our bones to help us move. They are connected to the bones by tough, string-like bands called tendons. You can think of tendons as a strong cables that pull the bone whenever the muscle is ready to work. These muscles are voluntary, which means you are the boss and you decide exactly when you want to move them. But how do they actually pull? It starts with a signal called innervation. This is like a tiny electric message sent from your brain through a motor nerve to wake up the muscle. When the muscle receives the signal, it contracts. Contraction means the muscle tightens up and becomes shorter and thicker. When the signal stops, the muscle relaxes, returning to its original shape by becoming longer and thinner. Muscles usually work in antagonistic pairs, which means they are teammates. When one muscle in the pair pulls tight to move a bone, the other one relaxes to let the movement happen. This teamwork allows us to perform different types of moves. One common move is flexion, which is the academic word for bending. When you bend your arm at the elbow, you decrease the angle between your bones. The opposite is extension, which is straightening your limb to make the angle bigger again. We also have moves called abduction and adduction. Abduction is when you move an arm or leg away from the middle of your body, like lifting your arms up to your side. Adduction is the opposite. It is moving that limb back toward the middle of your body. In conclusion, our muscles and bones work as a perfect team by using nerves to contract and relax and tendons to pull our bones. Our body can perform all the actions we need for life. Thank you for listening my part.
Most regards to everyone. So at the end of this story, I hope you guys really understand of how the muscular system, the function of our body. So as we know, we have our bones, muscles, joints, and also a movement to make our whole body make a movement to every single parts. Like the body structure. For work, they support our body weight, but the essential organs such as the brain, hearts, and lungs may serve as attachment points for muscles. Muscles, on the other hand, are responsible for generating movement. When a muscle contracts, it pulls on the attached bone through tendons, creating a force that allows the body to move. However, the movement will not be possible without joints. Joints connect bones together, allowing flexibility and wide range of motion. They also contain cartilage and synovial fluid, which reduce friction between bones and ensure the movement remains smooth and efficient. In simple terms, bones provide support, muscles create force, and joints allow movement. Together, they form the musculoskeletal system, enabling the body to function effectively. A simple example of this integration can be seen during the walking. As we know, the femur, tibia, and fibula support our body weight and act as a lever for movement. At the same time, muscles such as quadriceps, hamstring, and calf muscle contract and relax in coordinated manner to move the leg forwards and maintain balance, while the knee and ankle joints allow the leg to bend, extend, and rotate smoothly. Without the proper coordination of these three components, even a basic activity like walking becomes difficult or impossible. Another excellent example is lifting an object. When lifting, the spine, pelvis, and arm bones provide stability and structural support. The muscle of the back, shoulders, arm, and legs contract to generate the force needed to raise the object. At the same time, the shoulder, elbow, hip, and knee joints provide flexibility and coordination, allowing us to fit safely while maintaining our balance. This coordinated action not only make lifting possible, but also help minimize stress on the body and reduce the risk of injury. In conclusion, the musculoskeletal system demonstrates how bones, muscles, and joints depend on another to perform everyday movement efficiently. Bones provide strength and protection, muscles generate and therefore because required for movement. Joints also ensure flexibility and smooth motion. Whether we are walking, lifting, running, or simply standing, these three components must function together in a perfect condition. Therefore, maintaining healthy bones, muscles, and joints through regular physical activity, good posture, and a balanced diet rich in calcium and vitamin D is also essential for preserving mobility, preventing injuries, and ensuring a healthy, active lifestyle. Thank you for your attention. This will be a conclusion for